I'm sad, deeply saddened. But it is what it is.
58-year-old photographer Vincent Giordano is used to looking at life through a clear lens. Now, as he confronts advanced esophageal cancer, seeing things clearly is more important to him than ever.
What do you think the different possible pathways are?
It's over for me very, very soon.
Giordano has decided to stop chemotherapy. Instead, Memorial Sloan Kettering is giving him palliative care,
so I think a lot of education is required in it.
Which means relieving symptoms like nausea and pain. It's not about trying for a cure or resorting to feeding or breathing tubes. The hope is to enable him to go home.
Hope's got many dimensions to it. It isn't all just about living longer.
Studies show that most patients don't want to spend their last days in a hospital. Dartmouth researchers analyzed how well this wish is fulfilled around the country. They found the quality of end-of-life care varies widely. In Mason City, Iowa, just 7% of patients died in the hospital compared to almost 50% in Manhattan.
The care they receive is much more dependent upon where they receive their care than the care that they want.
Within Manhattan, there were large differences among hospitals. At Memorial Sloan Kettering, 34% of cancer patients died in the hospital. At Lenox Hill, that figure was nearly 50%.
Many patients are dying away from their families, in unfamiliar settings, with a lot of discomfort and pain, and that's a tragedy.
Another measure, aggressive treatment at the end of life, when the chance for a cure is remote. At Sloan Kettering, just 4% of patients received chemotherapy in their last 2 weeks. At Lenox Hill, that figure was over 12%. Lenox Hill told CBS it's reevaluating the balance of burden and benefit of the use of aggressive technology with cancer patients, and that it has recruited physicians specializing in palliative care.
We'll be getting into bed soon.
From the beginning, Giordano's doctors have been honest with him about his odds, and that's prepared him for this moment.
I have to be a grown-up about it and say, this is where I'm at. This is where my wife and I, our lives have taken us right here. Today.
Helping patients find their way at the end of life is one of the toughest and most important jobs a doctor has. Katie?
Mr. Giordano was very brave to participate in this piece.
Yes, he was.
But it's a complex issue, John. But if most patients want to die at home, why are so many dying in hospitals?
Katie, I think that one of the big reasons is that doctors wait too long to start the conversation. And I understand, as a doctor, I don't want to take away hope, but I don't want to give false hope. The patients and their families bring their own very complicated set of emotions to the table, okay? So clearly, this is one of the very last taboos, but we've just got to get past it because it's very clear that patients do better when this discussion is held sooner rather than later.
All right. Dr. Jon LaPook. John, thanks so much. And if you or a loved one is battling end-stage cancer and you'd like to learn more, go to our partner in health news, WebMD.com, and search Cancer Hospice Care.